Hello, I'm Andrew Shore from Patient Power. There continues to be a steady flow of encouraging news about new treatments for indolent lymphomas, NHL. We heard a lot at the 2014 meeting of the American Society of Hematology in San Francisco, and it gave us a chance to sit down with many experts. One expert we met with is from Southampton, England. That's Dr. Andrew Davies. And he spoke to us about the importance of patients getting personalized medicine.
I think this is a really hopeful time for patients with indolent lymphomas. There are a huge range of new drugs that are being developed and they're being looked at, first of all, on their own for their effectiveness, and increasingly being looked at in combinations with chemotherapy or with other what we call novel agents. And there are a whole range of different drugs that may be working in different ways. There may be antibody treatments. These are big proteins that latch onto the surface of the cell and make the immune system work better. And then there are some exciting antibodies targeting the surface of the malignant B cell, but there are also some increasing information coming through about antibodies that augment the immune response to hopefully kill off the lymphoma cell themselves. And there's a whole kind of class of these antibodies called PD-1 antibodies that are causing a huge amount of excitement at the moment. The data's early, we're starting to get data on small numbers of patients, but we're recognizing that in patients who have had lots of treatments, that actually we're seeing some clear signal that they work, and that's a great springboard to take forward. So there's this whole class of antibodies, there's this whole class of drugs that affect pathways that are abnormally controlled in lymphomas. We've talked about this pathway, this PI3 kinase inhibitor pathway. There are a number of new drugs, other drugs that are being developed. And also we see this pathway, this drug called Bruton's tyrosine kinase, which is a really important enzyme in the whole process of cellular turnover in B-cell lymphomas, and there's a whole number of different drugs that can turn over and inhibit that pathway and are showing some really exciting efficacy in different lymphomas. And then we see a whole range of drugs that, we see drugs that may be modulating the immune sort of response to lymphomas and the whole environment that the lymphoma is in. So there's an absolute wealth of different drugs that we can look at, and there's this big sort of buzz about looking at chemotherapy-free futures for treatments, and I think that that's a really positive thing going forward. Whilst we're not there yet, but actually I think that there's a whole raft of very exciting things that we are looking at and will hopefully be at the clinic within the next couple of years. I think my take-home message is to have a really good conversation with your oncologist or your hematologist about your treatment. The first-line treatments that we use are firmly established based upon studies done with very large numbers of patients, and that's why that your treating oncologist or hematologist will make a recommendation, probably based around conventional chemotherapy or some of the older drugs. What we're looking at now in very carefully controlled studies, doing clinical trials to look at whether the usefulness and the safety profile of these new drugs early in the course of the disease. And we need to do that in a really controlled way, and that's why we do clinical trials. So ask your oncologist about participating in a clinical trial. Those patients who have disease that's come back after having had previous treatments, then again ask your oncologist about novel agents, about clinical trials and participation, and make that a very sort of two-way conversation, and you can try and understand where we are in the development phase of these drugs.
We have a lot more on the latest news and how patients can get the treatment that's right for them, so be sure to check us out. I'm Andrew Shore. Remember, knowledge can be the best medicine of all.